I'm going to be demonstrating how to administer an IM injection using the ImZtrack method and reconstituting medication, following the 6 rights of medication administration, which are right patient, medication, dose, time, route, and documentation. First thing I do is check my doctor's order against the MAR, which for this demonstration I'm going to be drawing up 2 milliliters of medicine. For my calculation, I need to draw up 5.6 milliliters of diluent, and I've already checked that it's the right diluent for the medication. I need to perform hand hygiene. I'm going to open these vials, clean the tops of them with alcohol swab, remove the cap, making sure not to touch the needle. I'm going to draw up 5.6 milliliters of air from the medication vial. Oops. I'm going to inject that air into the diluent vial. I'm going to draw up the amount of diluent that I need. Going to inject that into the medication. I'm going to swirl this to completely dissolve the medicine. Once that's dissolved, I'm going to clean the top again. Now I'm going to drop the amount of medicine that I need. Making sure there's no air bubbles. Going to recap. Single-handed technique. Dispose of that in the sharps container. Before I would head to the patient's room, I'm going to check that I have the right medication, patient, and dose. When I get to the patient, I'm going to ask them for 2 patient identifiers, such as name and date of birth. Can you tell me your name and your birthday?
April 10th, March 2000.
Okay, do you have any allergies?
No.
Okay. I'm going to perform hand hygiene. I'm explaining to the patient what I'm going to do. I'm going to be giving you an IM injection in your vastus lateralis, which is the lateral side of your thigh muscle here. To find it, turn just a little bit. You go the midline, the top of the thigh, the side of the thigh, and you're going to be giving it to this area. I'm going to put on clean gloves. I'm going to clean the injection site in a circular motion with an alcohol pad, starting from the center and going outward. I'm going to put on a sterile needle. If this were a real injection, I'd be uncapping the needle. Instead of pinching up the muscle, and be holding the skin tight, pulling the muscle down. I'm going to inject the needle. I'm going to actually aspirate To make sure that I don't drop any blood. If I were to draw blood, I would pull out the needle, drop new medicine, start again. After I have aspirated to make sure that there isn't any blood, I'm going to slowly inject the medicine. I'm going to remove the needle, discard sharps container, let go so that the muscle snaps together, gently blot, but not massage. I'm going to ask the patient how they're feeling. Is that okay? I'm going to document what I did, so the medicine I gave, the site that I did the injection at, how the patient responded.